Hello and welcome to The Explainer. There's a new drug making some serious waves in the multiple sclerosis community. And, it comes with a really big promise, a new kind of hope. So today, we're going to break it all down, what it is, how it's supposed to work, and what it could really mean for the future of MS treatment. So you've probably seen the headlines, maybe you've been in the online discussion groups. There's a lot of talk about a potential new treatment on the horizon, and it's sparking so many questions. What exactly is this drug? How is it any different from what's already out there? And, most importantly, what does the science actually say? Let's dive in. Okay, first things first, before we go any further, let's just get on the same page about the name of this thing. Because believe me, it's caused a little bit of confusion. Yeah, if you've ever typed something like tolebrutinib into a search engine and just hit a wall, you are not alone. The correct name is tolebrutinib. So now that we've got that out of the way, we can really dig in to what makes this drug so fascinating. So what is tolebrutinib really? Why is it getting so much attention from researchers and, of course, from patients? Let's get to the key things you really need to know. So looking at it quickly, a few things really jump out. First, it's an oral tablet you take once a day. For anyone dealing with infusions or injections, you know that's a huge deal for convenience. But honestly, the science is where it gets really exciting. It's brain penetrant, which means it was literally engineered to get past the brain's natural security system. And its official title is the key. It's a BTK inhibitor, which tells us exactly how it's supposed to work inside the central nervous system. The company developing it, Sanofi, puts it perfectly. They say it was specifically designed to target smoldering neuroinflammation. And that phrase is everything. See, this isn't about fighting the big, obvious flare-ups of a relapse. It's about going after a hidden, more stubborn fire that helps the disease progress over time. Right. That term, smoldering neuroinflammation, that is really the key to understanding why tolebrutinib is such a different approach. So let's unpack what that actually means. Think of it like this. A relapse, that's like an open campfire. It's obvious, it's active, you can see the damage it's doing. But smoldering neuroinflammation, that's more like the hot embers that keep glowing deep inside the logs long after the main fire is out. It's this chronic, low-level inflammation inside the brain and spinal cord. And it's what many scientists believe is a major reason why disability can get worse, even when you're not having obvious relapses. So how does it fight those embers? Well, it's basically a targeted three-step mission. First, it's designed to get past the blood-brain barrier and actually enter the brain. Once it's in there, it gets to work, blocking a specific enzyme called BTK. Now, blocking that one enzyme creates this powerful ripple effect. It calms down the very immune cells, like B cells and microglia, that are responsible for fanning those embers of chronic inflammation in the first place. Okay, so the theory sounds incredible, right? But does it actually hold up in the real world? Well, the answer is in the clinical trial data. And what it's showing so far is exactly why there's so much excitement. One of the most hopeful things about this is just how broad the investigation is. Tolebrutinib isn't just being looked at for one type of MS. It's being tested in major phase 3 trials for relapsing forms, for secondary progressive, and for primary progressive MS. It's covering the entire spectrum of the disease. And here it is. This is the big headline that's gotten everyone talking. In a huge phase 3 study, the Hercules trial, tolebrutinib was actually shown to slow down the progression of disability in people with non-relapsing secondary progressive MS, a form of the disease that has been notoriously difficult to treat. Now, when you dig into the specifics of that trial, you see a really interesting picture. The imaging results, they showed a clear win, a significant reduction in new brain lesions, those new areas of tissue damage. But it's also really important to be clear about what it didn't do. It didn't have a significant impact on slowing down the overall loss of brain volume, which is also called atrophy. And this gives us a fantastic snapshot of both the drug's amazing promise and the areas where we still need to learn more. Because of these promising results, especially for non-relapsing SPMS, the FDA gave tolebrutinib what's called breakthrough therapy designation. And trust me, this is a big deal. It's not a guarantee of approval, not at all. But it's the FDA basically saying, hey, this looks like it could be a substantial improvement, so we're going to help speed up the review process. So that breakthrough status puts the drug on a bit of a fast track. So what does that road to approval actually look like? And when might we finally get a decision? Okay, here are the key dates to keep an eye on. The breakthrough designation came through in December of 2024. Then just this past March in 2025, the FDA officially accepted the drug's application and gave it a priority review. All of this is leading up to the big one, the target decision date. The FDA is expected to make its call on or before September 28th, 2025. So, with all of this hope, with all of this promising data flying around, it is absolutely essential that we remember where we are right now.
today. Tolobrutinib is still an investigational drug. It has not been approved, not by the FDA, not by any other regulatory authority anywhere. The process is moving, yes, but the final chapter hasn't been written yet.
And that really leaves us with the billion-dollar question, doesn't it? We have a once-a-day pill. It's designed to get into the brain, and it targets that chronic, smoldering inflammation that drives progression. The data we've seen so far is definitely promising, and the path to a final decision is clear. So, could this be the drug that truly changes the game for people living with progressive forms of MS? I guess only time and, of course, the final data will tell.